Betty Davis once said, "Growing old is not for sissies." How right she was. Perils of Aging, tonight, on call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. When you're young, you never think you'll be old, but at some point you realize there is no escaping it. How you view getting older has a lot to do with your health, your relationships with family members and with friends, and your general outlook on life. But before we tackle those issues, let's take a look at this week's Prairie Doc quiz question. What percentage of all reported elder financial abuses are committed by the victim's own family members? 20%, 50%, 90%. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays originally written for this show comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answers in. But we also answer your questions, your comments about aging, as they are called in or sent to us via Facebook or email. Call in your questions to 1-888-376-6225 or send us an email to the address on the screen. It's your show. Please give us your questions and we'll do our very best to answer them. Joining us tonight in our studio are Dr. Victoria Walker, Chief Medical Officer with the Good Samaritan Society, and Dr. David Brechtelsbauer, geriatrician, USD Stanford School of Medicine. And via Skype from Connecticut is Maggie Callanan, a hospice nurse and author of the book Final Gifts. Thank you all for joining us.
You're welcome.
So I'd like to talk a little bit about long-term care to start with, Victoria. You're the Chief Medical Officer for how many nursing homes?
About 160.
Long-term care nursing homes, same thing, right?
Pretty much.
But what else is directed by the Good Samaritan?
So Good Samaritan has a lot of services to meet people where they're at as they get older in that journey. So everything from affordable housing and senior living communities, home health, hospice, assisted living, so a lot of services. And of course rehab too.
So rehab, and that's doing the long-term care thing. Recently I was asked to review a book by Atul Gawande called Being Mortal, about dying. And really he was, the majority of the book was about his father's dying. And then he spent some time talking about nursing home care and care of the elderly in the United States. He was kind of frustrated with it, actually. I think he was kind of frustrated with his dad's death. I would think he was kind of angry, actually. And although I sensed that it was a good book, he spoke very negatively in some time, during some of his things. And I want to read these. He said, in India, his grandfather could count on a vast extended family constantly on hand to let him make his own choices. And our elderly are left in the U.S. with a controlled and supervised institutional existence, a medically designed answer to unfixable problems, a life designed to be safe but empty of anything they care about. And then he also wrote, Lou Sanders was on his way to joining the infantilized and catatonic denizens belted into the wheelchairs of a North Andover nursing home when, and then he went on about he found another place or whatever. Those are not very nice words about nursing homes.
No.
And I'd like your comment, and I'd like all of your comments about them.
Sure.
So what do you think, Victoria?
Well, you know, I think that nursing homes have a bad rap in that kind of characterization that he just described. But there are hundreds and hundreds of pages of regulations that are written specifically to make sure that people that live in long-term care have choice and that they receive person-centered care. The days of people being belted into wheelchairs is
Long gone.
long gone. And so there's really a big emphasis on there being choice in as many things as people can have choice in. Now it's difficult because a lot of people are in a nursing home because they need a lot of assistance, and that's just it's painful to know that sometimes you might need assistance as you get older, but thank goodness that there is somebody there to help if you do need assistance.
Right. Not all of them are demented.
No.
I mean, some think that's the repository of dementia. Well, in some sense it is, when they get to a point where there's just no way you could care for them at home, or there's nobody at home to care for them. Mm-hmm. And this idea of what he talked about in India, you know, most of the people are two-family workers. I mean, two-member workers in a family. We don't have a way to do that in this country anymore. Mm-hmm.
Yeah, families are really stretched thin. There's not as many of us, and we do work, and we move around the country as well. And so all of those things make it really hard for families to try and do what he's describing.
I've heard people say, I don't want to ever be there, and I think that's really a mistake, and kids should never promise their folks that they won't put them in the nursing home, quote unquote. They should say, Dad, Mom, I will always be there for you, and I will have your best interest always at mind.
I enjoyed a conversation with the patient, an elderly lady who was aging successfully, and with her daughter in the room, she said to me, if you want to put me in a nursing home, I'll trust your judgment and that'll be okay. I will not be happy about it, I'll go kicking and screaming, but if it's necessary, it's necessary. I don't want to be a burden on my daughter.
Right, and in that way, she's remaining independent.
Yes.
She's not depending on her family. I know of a beautiful woman in her 90s staying at home right now, and I had a conversation with her family recently, and they said if she went to the assisted living, she would have all these people to play cards with. She could hold court like she usually does when there's a group of people. She'd love it, but she doesn't want to do it yet, so we'll wait on that. Victoria made a point about the regulations that we have. You know, everybody says less regulations, but I think in this manner, regulations are important. It makes, these are people at tremendous disadvantage, and it's important to make sure that they are not taken advantage of.
I agree.
Maggie, tell us what your comments about this conversation would be.
Well, I have visited many long-term care facilities because hospice will provide care in long-term care facility, in addition to the care that they're already getting. And I think the socializing aspect is very important. I see very loving families talk about bringing Mom to live with them. She sits by a window upstairs, and the family's gone to work, and the children have gone to school, and she's alone, and all she does is walk for the mail truck to go by. And you have to think she would be happier having people around her. And so I think there's definitely a place for long-term care. Sometimes it's not being at home all by yourself.
I think that it's important that we realize, and I think here's the bottom line, everybody. We have wonderful nursing homes in this country. I know particularly the three that are in my territory are fabulous places. I remember going to a Good Sam Center to visit friends, and I thought I was going into a fancy restaurant. Well, it was not. It was the dining room of the nursing home, of the long-term care center. We have a bad rep, and that is wrong. These are good places. They're very carefully monitored. You're safe there. Let's move on to the question that always comes up. How do I not age? How do I keep from getting old soon or too soon? And I think that's a real deal. I think that there are ways to prevent the disabilities that can come with aging. David?
Well, we're all going to age and even die. But some of us age more successfully than others. Sometimes that's just good luck, but it's often how you live the beginning of your life, how you'll do in the end of your life. The importance of maintaining a healthy outlook, maintaining a healthy diet, continuing to exercise. In fact, there's more and more emerging evidence that exercise is a big factor in preventing or at least delaying the onset of dementia. So it's worthwhile taking care of yourself. You know, Yogi Berra said, or somebody said, I thought, no, I was going to live this long, I should have taken better care of myself. Yes.
I love what you said about exercise. I mean, that in my mind is the golden fleece. And we don't give it enough power. It's way better than any pill that we can prescribe. And we know that people die 31% less death in people who can walk just a mile a day. Just spend 20 minutes a day or 20 minutes of exercise. If you go all the way up to a full 3 miles a day, you'll increase it from 31 to 39%. But it's the first mile that really matters. Vicki, any comment about that?
You know, I think we underestimate the damage that we do to ourselves by watching TV. And so I think about that. Well,
And
don't
we're TV
anybody
right
turn
now.
it off right now.
Not this show. Not this show.
But in general, I think that there's a lot of studies that are coming out that are really talking about the risks with each additional hour of TV you watch during the day.
Yep.
And so I think that that's just something to be mindful of, because I think back to Maggie's point about isolation, that sometimes when people are having difficulty getting out of their house, it's easy to just kind of plant in front of the TV, and that has hazards all of its own. And so, not that TV is inherently evil, but I think that making sure that that it's not on excessively is important.
Well, I would say you can watch TV if you get out and on the days that you exercise. Maggie, any comment that
Yes.
you would like to add?
I think personally, an important thing in slowing down aging is to mentally stay involved in challenging activities. It's also important to spend time looking past your own world, your own needs. I live in a retirement community, and there's a lot of very active people here, many involved in voluntary meals on wheels, volunteering Hospice, working at the library, and these are vital, vibrant people. So I think mentally your mental focus has a lot to do with how you perceive your own aging.
I see people doing crosswords and word finds, and there's some evidence now that if you do that alone, it's not nearly as beneficial as if you do something like a Bible study with friends.
With friends.
And you're interacting like we are tonight. So we're preventing aging, folks. Let's
Right.
go for it.
Here, I feel younger already.
Yeah, there you go.
I would say that, and I've read this very same thing, is that there is no puzzle that is quite as good as a conversation with a friend. I mean, not, hi, how's the weather, you know, but a interesting conversation where you listen to what they say and then they listen to what you say. How medicines impact our bodies changes as we age. It's important to keep watch over what we take and the instructions that come with them.
You know, when it comes to taking any medication, whether you're on one medication, 10 medications, or 30 medications, you know, it's important to make sure you ask the provider or the prescriber questions about what's the medication for. I think sometimes when we talk about adherence, sometimes patients won't take a medication because they're not 100% sure what it's for. You know, another thing for patients to do is to have a conversation about, you know, is this medication replacing another medication? And so, you know, pharmacodynamics and kinetics, which is really just a fancy way of saying how medications are utilized and broken down in our body, are different in the elderly population. And so you might give a medication at a certain dose for, you know, the vast majority of the population, but in that elderly person or the elderly population, it might take longer. So rather than giving it every 24 hours, you should give it, you know, every day and a half. Adherence, I think, is something we have to worry about in every patient population. It's not just in the elderly. Another one in the elderly population would certainly be cognitive. You know, they might have some early onset dementia or some of those types of things, and so that might cause them to forget to take one of their medications. Another one would be the fact that they're on multiple drugs, and some have to be taken in the morning, some have to be taken with food, some have to be taken at bedtime, and we have to be careful of any dizziness and things like that to protect from falls. Hallucinations is another thing that we worry about with regard to adverse effects in the elderly population. Bleeding, there's a number of elderly patients who might be on antiplatelet or things like Coumadin, blood thinners. I think when it comes to adherence, some of the things that we can do, again, whether it's a provider or a pharmacist or whoever it might be, is think about dosing regimens, really try to focus on medications that only have to be taken one time a day. Medication therapy management, yep, and so they're able to sit down with the patient for what commonly is referred to sometimes as a brown bag session, where a patient will bring all their medications in a brown bag and they'll sit down with the pharmacist, and he or she is able to sit down and go through them with them and talk about, how often are you taking this medication? Do you have any side effects with this medication? One of the things I think is important is that you work with your pharmacy. I think it's important to go to one pharmacy on a regular basis so that they're aware of what medications you're taking and can look for drug interactions, watch your compliance, some of those types of things. They can also look for duplication of therapy.
We sure appreciate that, Dr. Hansen. The value of the danger of polypharmacy is real. There are things you can do. I want you to remember that this is your show. Your questions are key to our show discussion. Call in your questions about issues around aging. Make your comments to 1-888-376-6225 or send us an email to ask@prairiedoc.org. Polypharmacy, before we get into questions, and we do have questions, thank you. What's your comment about polypharmacy, Vicki?
I would say to remember that things that you buy at the drugstore over the counter count as medications as well, and so it's really important to make sure that you talk to your doctor about those and don't just start taking things over the counter without checking with your doctor, especially if you're on other medications, because they can often have some pretty serious side effects.
Well, and certain of them will absorb the medicines that you're taking that are important. And your heart rhythm may go out of whack, or your blood pressure may go up, or it may counteract the function of other medicines. Any comments, David?
I really want to endorse the pharmacy comment about having a local pharmacy go to one pharmacy. And I know people have limited income, and your Medicare D plan will encourage you to get 3 months at a time from a mail order pharmacy in Atlanta or someplace. And if your money if you have to do that, you have to do that. But if possible, if you have a local pharmacist and getting all your medicines in the one place, that's a beautiful safety belt that person who's very knowledgeable is looking over that. There's also a new concept about de-prescribing. It sounds like a big, long word, but...
I love that.
Yes, it means you're going to sit down with your doctor and ask questions, and he'll ask you questions about what you're hoping to get out of your medicine. And particularly if there are multiple prescribers, there may be a lot of individual decisions that are correct given that organ system that prescriber is taking care of. But together there's burden just in terms of the numbers and keeping track of them and paying of them, but sometimes serious interaction. And many medicines we give nowadays don't make you feel better. They're designed to change a number in your chart that's associated with maybe not having a heart attack.
Yeah, but you may not feel better taking the pill.
So you have to decide, pin your doctor down. If I don't take this medicine, how much risk am I running as opposed to somebody who's on it? And you may decide that for a 2% gain, in your life expectancy, it's not worth taking medicine for 30 years and paying for it and remembering to take it and running out of it and having it sent to the wrong airport by mistake and all the things that happen.
It's a great joy to have a personal pharmacist, Tom Carlson, my friend and my pharmacist, just like my doctor is Dan Cecil. Tom Carlson's my pharmacist, and I can depend on it. I would make one other comment. The studies say 60% of people 60% of drugs are actually taken, that 40% are not taken, and that if you're doing that, and many are, tell your doctor. Make sure you let your doctor Becky, any comment before we move on to questions?
Well, I would agree with many of the points that Dr. Brechtelsbauer mentioned. One of the first things we do when we admit somebody into the hospice home care program is to ask to see every medication that they take. And it's not uncommon for somebody to walk out pushing a 3-tier cart. Working in a more metropolitan area, many patients see a number of different doctors without clearing the medications with each doctor. And the first thing we often do is to eliminate all non-essential medications. And surprisingly, the patients feel better.
And they get better.
I've had patients say, I didn't expect to feel better just because I entered the hospice program. So yes, it's important we try and streamline and keep it simple to the medications that have the end result that we want in the terminal process.
So we've got some good questions, and we appreciate the calls, and keep them coming, please. Please give us your calls. That's our input. That gives us some direction. A 74-year-old Facebook viewer asks, can degenerative connective tissue loss be reversed through diet and exercise, or is a result of aging and cannot be controlled? So connective tissue loss or degenerative joint disease, can that be replaced with diet and exercise? David?
It won't be back to when you were 18 years old, but if you exercise on a regular basis, you'll get increased range of motion, increased strength. There's wonderful studies of looking at people doing weightlifting exercise to actually build muscle mass and measuring that with high technology CT scans and volume and so on. You can measure it very precisely, and an 80-year-old will have a gain similar to an SDSU football player. But you have to maintain it. If you stop doing the exercise, you'll lose it. So use it or lose it is a phrase we use often.
Right. I've heard them say cartilage can even be built by activity. And I think your point is that, if you're not going to be using your joints, they stiffen. Mm-hmm. And so I think every day our job should be that walking, that stretching, maybe a little hopping for the bone strength and for balance, and a balance exercise. So those are the 4 parts of it.
And it doesn't have to be super strenuous. We're not talking about going out to run a marathon. We're talking about going for a brisk walk.
Yeah. That's
and little stretching and bouncing.
So yes is your answer. Why do nursing home institutions want to extract the last 5 years of finances people have left? So let's talk about financing. I think that you have to know that it costs some, and if you're a person who has individual wealth, they're going to want to be paid. Nursing home insurance, long-term care insurance is available. I'm not necessarily a fan of long-term care insurance, but others are. Vicki.
Well, this is a really challenging problem because we talked about that it's a good thing that nursing homes have a lot of regulations, but that it's expensive to follow regulations, and there's a lot of professional staff that's necessary to staff a nursing home to meet all those regulations.
Yes, that's exactly right.
And most importantly, it's important that there's direct care workers or aides that are there to help people do important things like be able to to lay down or to get up and to get dressed and to sometimes to be helped to eat and go to the bathroom, and those people it costs money, and it just does. And in a nursing home, you've got caregivers that are there 24 hours a day, 7 days a week, and that is expensive. And that typically I would say it's around $7,000 a month, which runs through most people's savings very quickly. And so that is a challenge because then what happens when you run out of money? And most people end up qualifying for Medicaid. And thank
But
goodness.
if you have a couple, you will only run through half of their amassed and not their house, right?
Right. Yeah, that is true.
My mother had an amassed fortune, I thought. Well, it was not huge, but it was $200,000, and so she became in an apartment, sold her house, then she went into an assisted living, lived there for several years, till strokes kind of took her into a point where she had to move into the nursing home, lived into the nursing home, used up all of her funds. I had to buy the lake cabin from her. And then when she finally ran out of all of her money, she lived another 2 or 3 months and then died at 92. My life wouldn't have been any better. My kids wouldn't have been better off had she found a way to give us our money, or she just used up her money. I thought it was probably just right.
I think the caller may, though, be thinking about this spend down process.
It's giving away all of the farm.
You can't give things away 1 minute before you need to go into the nursing home. That's considered fraudulent behavior. There are ways to do estate planning ahead of time, and that you can create various things that you're going to send to your kids or whatever you want to endow to prevent having that
dilemma
at the end.
So I think you need to have a good financial planner. Talk about that whole scenario. Are you a supporter of long-term care insurance?
Well, I like the theory. The way that it currently exists isn't good. It's not
great.
Financially working out.
And it's very expensive.
It sounds like I may be the only one on the table who has long-term care insurance.
Yeah, it might be.
Okay. The first
No, I
problem,
have it also.
Oh, good.
I
Okay.
also have.
Okay, I'm glad. Thank you, Maggie. You always think you don't think you need it right away, so it means you sign up late, and then it gets expensive because there's not that many years for the insurance company to collect from you. But I have a personal friend who had Parkinson's and a dedicated spouse caregiver in a house that wasn't very compatible with that. And because that family had long-term care insurance, adult daycare was reimbursed. The home modification was reimbursed with long-term care insurance, because they knew if he went to a nursing home, that would be much more expensive, and they could do things that were expensive but kept him home probably literally months longer. He did eventually spend the last 2 months maybe in the nursing home, but he stayed home a long time with just a single caregiver. The kids from out of state came periodically to relieve their mom. But his life was a lot better at home because they had long-term care insurance.
I kind of see it as a way to protect your children's inheritance, but I really don't think that our kids benefit a great deal from money for nothing. Something for nothing is never really an important issue.
And Vicki mentioned the rehab part of long-term care. At least half of us, and probably more, we're going to spend some time in a nursing home before we die. Some of us after a fractured hip for rehab, or after a stroke for rehab, and then go back home, or assisted living, or where we live. And some of us are going to be there for the rest of our lives.
And
in fact, more deaths happen in South Dakota in nursing homes than any other single location.
yeah. A man from T has a relative in a nursing home in Sioux Falls, and noticed that the room is clearly only meant for one person. Her relative has a roommate. Are there any federal regulations on the square footage a room can have that is shared? Vicki, you know the answer to that?
I don't think I have seen a regulation on square footage. Have you?
I think it may be in the life safety part.
Okay, I haven't read the laws as closely. So
There is so much square feet, but it's not generous. I mean,
No.
they may be within the regulation, despite the fact it's pretty crowded.
A woman from Custer wonders if her docs have an opinion on bioidentical hormone replacements used in the elderly, and then we'll get to the roll-in. Bioidentical hormones. I'm not a fan of it. It would be my first comment. It's basically somebody selling hormones to keep you from getting older, and really, let's face it, when we get older, we get older. There's no good way of protecting you from that, with one major exception, and that is a regular exercise program, communication with dear friends, and a decent diet which is not excessive.
If in fact you're actually measured deficient, hormone replacement may be appropriate, but the bioidentical is kind of a little sideline of people's...
A little red flag that tells me
yeah.
it's probably promoted and
maybe
sold.
overly promoted.
Yeah. Maggie, any comment?
No.
Okay. All right, so we're going to go to the roll-in, and I'm not seeing it. I'm seeing a picture of me, and Advanced care planning is the process that provides individuals, caregivers, and healthcare providers the ability to know and respect the wishes and goals of individuals at the end of life. Thoughtful advanced planning promotes patient autonomy by honoring the treatment preferences of the individual as well as respecting patients' rights.
These were funds that were provided to ESD nursing by the Bush Foundation. And the title of the grant is called Lighting a Spark in South Dakota, and SPARK stands for Serving Underserved Populations Through Advanced Care Planning, Respect, and Knowledge. The grant was provided to us in order to start conversations that can be pretty uncomfortable about end-of-life decisions in South Dakota. So what we're trying to accomplish is we're trying to spread information amongst the underserved South Dakota population. So we're specifically targeting rural areas, West River, East River, all over the state of South Dakota. We're also looking at minorities that may be living in South Dakota that also have a need and maybe have restricted access to information about advanced care planning. The advanced directive is not the end-all and be-all there. An advanced directive is very important, but it seems it's only one part of a process. In fact, it is our understanding that advanced care planning may change throughout an individual's lifetimes as the individual's relationships change. So does their advanced care plan, and that the advanced directive may have to be updated.
I work with students, and the first thing we start with is understanding the importance of developing an advanced directive, an advanced care plan. And we talk with students, and we also work with community members. And so we stress that the importance of having an advanced care plan is it increases the quality of care, specifically at end of life, and also decreases the expenses of the health care, and increases the community involvement in health. And then also it increases our provider satisfaction, because we've had the conversations already about our end-of-life care that we request. So when they see the provider, that there's less time needed by the provider to spend on these conversations because the population is already educated about the topic. And so that's the importance of the students and the population being educated about advanced care planning. From our population end, we work with students and community members, and we do training sessions through the Gunderson Foundation, and we do facilitator training sessions. And so our students and community members have joint training sessions, and they learn about the language involved with having end-of-life conversations so that they can have these conversations with their patients and with their family members, and then also with fellow community members. So populations that, when we're talking about people in the community, maybe parish nurses, social workers, anybody in the community that's interested in becoming, in working with the population and having those conversations.
That issue about advanced directives is just so very important, and we could spend a whole show on advanced directives, I think. Maggie, what do you think is the most important point that people should try to remember about giving a living will or an advanced directive to prevent excessive care at the end of life?
I think one thing that's often overlooked is that it's a gift that you give to your children or family members that will have a significant emotional and what's another word I'm thinking of? Guilt. It will help eliminate any guilt if they are forced to make decisions for you without your guidance. When I spoke to my own mother, who died at 93, I said, help me now. Give me information that I can be at peace with so that I can make sure that your death is exactly the way you want it to be. Don't make me guess. And from that point on, she was very, very clear what she wanted, including what she wanted to wear. So.
Well, and I also think that you can find advanced directives everywhere. There's one in South Dakota that is all laid out. But a lot of it is very complicated. There's legalese, and I know we're working on some more I want to hear about, David, but I want to make this point. The big bugaboo is the feeding tube. People who have a stroke or they get demented and then they get ill. There are places where people will put a feeding tube because nutrition is poor and you're not going to be able to get them to recover from this illness without this feeding tube, except they're demented or they're at the end of life and they don't remember or can recognize their family members. I want my family to know, and I've told them all individually, don't put that feeding tube in if I don't know or recognize people and know who my family is. I think that would save a lot of suffering because what happens is they're stuck in a feeding tube and then they go to a long-term care facility for years in a vegetative state, and that's not what anyone would want. Dave.
Brown University has looked at that, particularly in the setting of advanced dementia. A feeding tube for a brief time after a person has a stroke and they're expected to recover for a stroke probably is appropriate because it's going to be a 6 weeks trial, and if they're still having a severe stroke and not recovering, you take it out. But there may be a bridge there with a disease that has the potential to get better for use of feeding tubes. The other thing Brown University discovered is the upper Midwest has the least frequent prevalence of putting in feeding tubes. And I think it's because we're a little less cosmopolitan and we do have more primary physicians working directly with patients. And we need to do better, but we discuss these things better than some of our peers in other parts when everybody has their job but nobody's in charge.
I would only argue with you a little bit. When people have a stroke and they can't swallow, and the immediate knee jerk is to put that feeding tube in, I think that you starve a fever. You starve a situation like that. You let them dehydrate. The major problem is edema of the brain. By day 3 or 4, and they're fine without water and food if they can't swallow and it goes right into their lungs. By day 3 and 4, you can really kind of predict where we're going to be. There's the borderline deal where, in your example, you might want to consider the feeding tube and see what happens over the next 6 weeks. Not starting one is the same as taking it out. Mm-hmm. You can do that. Yeah. On the other hand, at 3 days or 4 days, you can look at a severe stroke and say, he would not want, this is a time to go. It's a nice exit. Let go. Pull the feeding tube. If they'll take food orally, fine. Water, food.
This is the depth of conversation you need to have with your family to know where you're going to be at that. It also, these conversations, as your health changes, it may change your goals of care. You become less interested in controlling your cholesterol when you're 88 years old because it's not helping you do anything more except you have to buy this pill and take it. So you not only need to do an advanced directive, but periodically you should just look at it again and make sure you still agree with what you said 5 years ago, because life happens and things change.
And I'll make one more comment and we'll move on to questions. And my comment is this. You have a nice ironclad living will, advanced directive all laid out, been stamped and approved, and everybody's in agreement. And you go to the emergency room, and I don't care what that says. If the kids want you to get the feeding tube or want you to be resuscitated or want you to get antibiotics for pneumonia or whatever it might be, the doctor will do that. They will not be sued by the guy that's in the bed. They could be sued by the family members, and they will follow the direction of the family. So the
Rick,
most
can
important.
I add?
Yes.
Can I add something?
Yes, Maggie.
First of all, we have to look at feeding tubes as not a panacea. They have side effects. The rate of aspiration is up in the 70%. that food and fluid will wash back up because the mechanisms are just not there to keep it where it's supposed to go. But you also have to look at your goal. Are you prolonging a quality of life, or are you prolonging the process of dying?
Right, there it is. Prolonging.
But there's the other thing. The other thing I wanted to add with my mother's living will, because I've seen living wills overridden too many times. We had a clause added in red type so it stood out. And that clause said, if any institution or person overrides my wishes as stated herein, I direct my attorney to seek legal action on my behalf or the behalf of my estate. We had no problem.
I love that. All right, now we have a bunch of questions. We need to answer them. Brief answers, quick. I'm going to go right now. A man who lives in an apartment in Brookings has an elderly neighbor that is on his last legs. He knows he needs to go to the hospice, but thinks he's an illegal alien. How would this affect the neighbor if he called to get him help? So the concern is, and you have a question, suggestion?
I think if you called Adult Protective Services, they would try to determine the person's need, and it wouldn't relate to whether the person had documents or not.
I think that's it.
I think most medical providers, just like our colleges and university, I mean, you can go to college in South Dakota and not have papers.
And can I speak for hospice? Anybody can call hospice.
It doesn't have to be the doctor. The patient can call.
No, it does
Family
not.
members.
Now,
Neighbor.
hospice will follow up and get all that information, but they will send somebody to check and pull in whatever resources are necessary, and we don't care about people's paperwork.
The caller is 70 years old from Akron, Iowa. This is the first winter. He's just sitting and watching TV and doing no exercise. Has a bike, not doing it. He's diabetic for 40 years. Numbers are good, but he does not have a lot of energy to do the things, but is wondering what simple ideas to get active. Vicki.
Well, I'm going to pick on the TV. And so, I think that one thing would be that if you know that you are spending 8 hours with the TV on, I'd set a goal to maybe only watch TV for 6 hours and to do something else those other 2 hours. It could be just spending more time cooking a meal, or writing somebody a letter, or putzing around the house, whatever it is that you like to do. But anything that you do will be more activity than sitting in your recliner.
That TV. Yep. So get up off that TV and get going. And if the only thing that's going to happen is you're going to get weaker.
Go up and down the aisles of any store in Akron, Iowa.
You can walk around the big box stores. Just go out there and walk around. Sioux City, a woman, could you differentiate the progression of Alzheimer's and dementia? David. Okay,
dementia is a general category, which means basically your IQ goes down as an adult. We call that developmental delay if it happens before the age of 18. Alzheimer's is the most common reason that happens, but there are other reasons like frontal temporal dementia and Lewy body dementia. So because Alzheimer's is the most common, it becomes almost a generic word. But it is important to sort that out because the prognosis difference and the complications might be different and the approaches will be different.
Yeah.
So
dementia is the broad category.
Right.
Alzheimer's is 50% or more of the dementias. Woman from Iowa has a 92-year-old brother that is experiencing frequent hallucinations. Sounds like Lewy body dementia. What can be done for this?
It's probably really important to get a good medication review and just
Medications.
a checkup, because I would say that oftentimes that can actually come from medications.
Parkinson medicines are the biggest culprit for hallucinations, are they not? We have a woman from Sioux Falls had blood tests which showed no thyroid action. What causes the thyroid function to diminish?
at some point in time, this person probably had thyroiditis, an inflammation to the thyroid, that healed with scarring and resulted in the thyroid not being functional. Fortunately, that's one of those hormones that can be precisely and elegantly replaced and monitor with the lab work so we can get her back to normal levels. So she should see her doctor to talk about that.
I love the word Hashimoto's thyroiditis. It goes along with other favorite words of mine like oligodendroglio and all sorts of things like that. But Hashimoto's thyroiditis is the most common reason for
Correct.
people. That thyroiditis, as you talked about, where your immune system attacks the thyroid and it goes, and it's a wonderful disease because you can treat it perfectly. And watch how you treat it. A woman from Sioux Falls asks, is there an advantage to sitting on fitness ball versus a chair when watching TV? Vicki?
Yeah, I think there is. And
You got to balance yourself.
exactly. Kind of exercises your core muscles.
Yeah, I've never sat on a ball and tried to balance for long periods of time, so you're giving me a positive. Any comment about that, Maggie?
Sounds like a great idea to me.
Okay. A woman from Sioux Falls would like to know the doc's opinion on a Comfort One bracelet. I have an opinion, but I'd like to hear Dave.
Okay, Comfort One is basically an order for the emergency medical technicians that if they see this document, they will not do what they normally would do if they find you down without a heart rate. If they found you dead and they think they can revive you, they will try unless you have a Comfort One. Particularly for people in assisted living, I think it's a really critical document. It's helpful in the nursing home also, but it only covers it comes through the Department of Emergency Services, and they're obligated to do the protocol for CPR unless that document, and you can wear a bracelet and have the document with you, unless that's in place. So if you're in the community and you're at risk for having somehow having your heart stop, and you don't want it started because you felt like you lived a full life, getting a Comfort One would be a good idea.
But don't call the ambulance when you have that cardiac arrest. Let her go. Death is a thing that we all fear. We've got less than a minute. Comment about fearing death. I'm going to ask Maggie first.
Yes, indeed. I think the biggest basis of the fear of death is the fear of being out of control. A plug for hospice. We will give you as much control as you possibly can have. You can make your own choices. I see myself as someone who will provide my patients their own personal designer death.
And any comment, Vicki?
Yeah, I think I agree that just that fear of loss of control, but also just the unknown. I think that there's not a person among us that knows for certain exactly what happens afterwards, and that's a little scary. But I think that the reality is that so far we're 100% mortality for human beings. So I think it's a good thing to spend some time thinking about.
It's dangerous to fear death. It's bad for your health. All right, and so, and now for the winner of tonight's Prairie Doc quiz question. What percentage of all reported elder financial abuses are committed by the victim's own family members? 20%, 50%, 90%? And the answer is 90%. The victim's own family members, most often the adult children, grandchildren, nieces, nephews. It was Linda Bartles from Humboldt who answered the question correctly. Thank you, Linda, for participating. A book will be in the mail to you soon. Again, don't forget Final Gifts. Go on Amazon, buy the book, Final Gifts by Maggie Callanan. Fabulous book. We'll be right back after this.
In a world where selfies are seemingly innocent, something lurks. And no one is spared.
How goes it?
It's flu season.
This abusive man was an only child, growing up loved but overprotected. He always received praise for being a nice guy, but had no discipline for uncontrollable bouts of rage and anger. He was protected from restraint or repercussion at school because his parents would pressure his teachers, and he dropped out of sports intolerant of direction. His marriages failed because whenever he felt criticized, he would fly into a rage And gradually, the emotional abuse became physical, with divorce to follow. When it was time to care for his elderly and dependent parents, he was again abusive. The parents were reluctant to confront him or call for help because they felt responsible and were terrified of his rage and physical threat, and worse, feared he would ignore them. There are many theories for why people abuse others. Psychologists say that every case is different and every abuser is driven by a different monster. Carrie Askin, a clinical social worker and author who has had extensive experience with abuser patients, says that abusers most commonly become that way because they never learned to tolerate criticism and retaliate when they hear it. She states that often abusers learn from their youth that she or he is entitled not to hear criticism, has the right to punish anyone who violates that right, and can do so without expecting repercussion. Isn't it a paradox that the most common reason for abuse happens because the abuser didn't experience fair discipline as a child? If one is to improve as a person, then people must learn to take constructive criticism very early in life. Those who haven't accepted this life lesson and who respond to every disapproval with anger and retribution eventually live an isolated, ignorant, and unfulfilled life as people run from them when they come near. There are other reasons why people become abusers. Some who have never known kindness and were abused themselves become abusive almost in self-defense. They were taught by example that abuse is normal and deserved. About 1/3 of the children raised in this kind of environment become abusive adults. This means, however, that 2 out of 3 raised in a family with abuse do not become abusive. Bottom line, abuse should never be tolerated. Children, spouses, and the elderly should be able to trust the people around them and live in a safe environment. Abused people should call for help from their physician, minister, social services, or even police. Well, a great big thank you to our guests, Victoria Walker, Maggie Callanan, and David Brechtelsbauer. Your breadth of knowledge and wisdom impacted tonight's program greatly. Thank you all for your volunteer work here. The flu season is at full speed. We have to keep enlarging our chart graphic for the program just to keep up. Remember, get your flu shot if you haven't yet. Wash your hands for at least 12 seconds. Cough into your sleeve. And if you're sick, stay home to reduce the chance of infecting someone else. That does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, stay healthy out there, people. And so,
your lifestyle and attitude about your medical state have an impact on your life. Handling illness, next time On Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
And with the ongoing support of these individuals and institutions.
Brookings Health System.
Ophthalmology Limited.
American Academy of Family Physicians Foundation and South Dakota Academy of Family Physicians.
Avera Heart Hospital,
Dakota Allergy and Asthma,
CoBank,
Fishback Financial Corporation,
Vance Thompson Vision,
Aberdeen District Medical Society,
Black Hills Medical Society,
3rd District Medical Society, Brookings Medicine and Flandreau,
Dakota Bank,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
and Swiftel Communications.